Hi, I'm Dr. Mackay. Today we are going to go over how to get out of bed with lower back pain, herniated discs, or sciatica. The key to remember is that in the morning you have the most disc pressure in your spine, which means that it is most vulnerable to injury in the morning. So when we get out of bed, something we want to consider is that we want to, as much as possible, try to maintain the normal lower back lumbar curvature. That's important because if we flex our spine forward early in the morning, if we're flexing our spine forward like this, what happens as the spine flexes forward this way is that can start to bulge and put pressure on the front portion of these discs through here, and they can start to gradually bulge or herniate further backwards, and that can certainly cause significant lower back pain. So especially early in the morning, we really want to be mindful to try to prevent a lot of forward bending, reaching down, especially getting out of bed in the morning. We want to minimize how much forward bending we're doing, and we also want to minimize how much rotation and twisting we are doing with our spine. So the two motions that are the most damaging to lumbar discs, to the lower back, are bending forward, flexion combined with twisting or rotation. So we want to minimize those. So to get out of bed with lower back pain, herniated discs, or sciatica, the first thing we want to avoid doing is this. We don't want to launch out of bed with flexion like this. We don't want to be bending our spine rapidly coming up, and we don't want to be bending and rotating or twisting at the same time, because that puts significant stress on our lower back, on those lower lumbar discs, which is not good. Instead, what we want to do is, if we're lying on our back, one thing you can do when you're sleeping is that you can put a small pillow under your knees just to take some of the stress off your lower back. But what we're going to do first is, if we're lying on our back, we want to shift ourselves slightly away from the edge of the bed. So just pretending that this is the edge of the bed. Then I want to roll as a unit, kind of like a log. So I don't want to be twisting my spine. I don't want to be twisting because that puts a lot of pressure on the lower back and discs. But I want to roll as a unit so that my torso here is attached to my pelvis and my legs. So I bring the top arm over and I roll as a unit over. And then what I'm going to do is, once I'm on my side, I'm going to take my top arm and I'm going to push myself up slightly as I let my legs fall over the edge of the bed. So it looks something like this. I'm going to push up as my legs drop, and I push myself up at the same time into the sitting posture. I collect myself then, because sometimes if there's severe lower back pain, severe herniated discs, or sciatica, just getting into the seated posture can be painful. I'm going to wait a second, I'm going to gather myself, I'm going to get some strength in my legs, and I'm going to slowly push myself up with my legs and my arms at the same time. Getting back into bed would be the exact same, but the opposite of that. So I'm going to come down with my arms. I'm going to bring my legs up just nice and slowly. So they're going to pivot up like this onto my side. Then I'm going to roll over as one unit. So I'm going to roll like this. So I'm not twisting. I'm keeping everything the same. And then I'm going to shift myself over without twisting my lower back.